All right, guys, we had a request on our Facebook page to talk about shin splints. So what I'm going to do is I'm going to talk about what shin splints are, why we get them, how to prevent them, and some things we can do to make sure that they don't come back. So we're going to do this in less than 6 minutes. So we're going shin splints in 6 minutes or less starting now. All right, what are shin splints? Shin splints are basically a garbage term that we use to discuss any pain on the front outside portion or front inside portion of our shin. Okay. Typically we think of it as irritation of the muscles that run along those two areas, whether it's the fibular head muscles, the anterior tib, or the posterior tibialis as it runs through and comes down through the arch. That's typically what we think. Worst case scenario, it's an actual stress fracture on the tibia or where those muscles attach. So if you have shin splints and they're wicked nasty, you need to go to your doctor and get them checked out. If you've injured the bone, you have to let the bone heal. Okay, it's too late to do some of these preventative things. The bone's got to heal. All right, so what's done is done. Get it fixed, get it checked out before things get worse. If you're just one of those people that tend to get them when you get into a running program, this video might be for you. You may be able to do some things to prevent those from coming back or for getting them in the first place. So why do we get shin splints? Okay, we're going to make the assumption that our body is designed to move well. It's evolved over all of these years. It's designed to run. It's designed to do all these things that we want to do. What it wasn't designed to do is wear high-heeled shoes and sit all day. And that's typically what I think gets us into a lot of problems. So we end up with these muscle tightnesses and imbalances in our body that it's not used to, and then we go to do these high-level sports or running, and all of a sudden problems show up and we don't get it. We don't know why. So if we don't have the mobility to move like we're supposed to, and then we get into a sport, we end up with trouble. So what we're going to assume is that our body's designed to have this arch. They call it the windlass mechanism. It's designed to have an arch that stays underneath our foot, that stays stable when we land and when we run on it. There's muscles that come through. The posterior tib is a big one. There's muscles in the foot that help that arch stay intact. And it's designed to make for a rigid lever so that power can be transferred up the leg. When problems happen, it's when that arch falls. We call it flat feet, you can call it whatever you want, you call it navicular drop, that bone drops. That changes the way the muscles all pull. It changes their angle of pull from what they're designed to be to what they go into. And when the force vector of that muscle changes, the angle of pull changes, your body has to do all kinds of nasty things to figure out what to do about it. So, muscles can get irritated, the body can lay down bone, and you get these nasty bone spurs. You end up with a heel spur, and some type of plantar fasciitis or shin splints, and it's just a result of that not moving properly anymore. So if somebody comes to me in the clinic, I'm going to check two things first. I'm going to check their ankle, and then I'm going to check their hips. Why? The pain's here. Why would I check those things? Well, these guys lost the battle. They're the ones that got beat up, but usually the problem is somewhere else. Okay, it's usually above or below stream, as we like to say. So we're going to look below stream first at the ankle. At the ankle, I should be able to dorsiflex without my foot falling, okay? In an ideal world, arch is intact. I'm going to bring that knee forward with that arch staying intact. If I drop the line from the front of my knee down through the front of my foot, I'm hoping to get 3 to 4 inches. I'm probably a little bit short there. And so what you want to do is that's a position that I'm going to want to work. You have to be careful when you check this that arch doesn't collapse. What our body does is it knows that in order to run and do some squatting type movements that we need to be able to get that knee out in front of the foot. And if you watch that, whoop, what it'll do to allow me to get further out in front of the foot is it'll let that arch collapse. So now all of a sudden I can dorsiflex a lot further, but I did it at the expense of the stability of my arch and the stability of my foot. Now we get all those weird muscle pulls, trouble. Okay? So one of the things you got to do is you got to make sure you have enough dorsiflexion range of motion. Okay, so we're going to check the soft tissue and we're going to check the joint stability. For the soft tissue, I like to use a tennis ball or the foam roller, and I like to hit 3 main spots. One is on the inside of the shin, and if you work along the inside of the shin through where your calf muscle belly is, you're going to find a spot that's really tender. We think you're hitting your posterior tib tendon. That guy's always nasty, so get in there, dig that guy out, make sure it's clean. The next spot you're going to want to look is the outside part of your shin. If you find that bone, that's the fibular head, work through the front of your shin. If you find some stuff that's kind of knotty, dig that out, take the tennis ball, get in there and roll through that. The last part I like to check is the back part of the calf here. It gets all knotted up. I want to hit that where the muscle belly meets the tendon. Again, my tennis ball or lacrosse ball, I can roll through that. You can also use your foam roller and roll through there. Okay? I'm also going to then check the hip. Okay? So I want to make sure that ankle's clear. Oh, joint stuff.
Once you clear the muscle, you're going to want to work that joint. So get into that kneeling position, keep that arch intact, and work the joint. Take it into that end range position. We're going to cover some things that you can do with a band to make that a bit better in some future posts. The next piece I want to look at is my hip. I want to look at the front of the hip, and I want to look at my ability of the hip to rotate in. The reason I want to do that is the hip creates single leg stability. If my hip falls in, my arch falls in, everything collapses, I'm going to have trouble. So I need to make sure that I can stand on one leg and I can run and I can do all those things without my knee buckling, and when my knee buckles, my arch goes. Okay, so we're going to look at the front of the hip. We're going to get in this area here. We're going to bring a chair into the picture or a couch. Get your knee on there. Back is straight, belly is tight. I'm going to tighten my butt and I'm going to work myself back to my heel. I should be able to get my heel to my butt. This is the reason I have trouble with my squat. So this is a position I'm going to work. I'm going to do some contract relax here. I'm going to squeeze my butt, squeeze, 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 and then lean back. Squeeze my butt for 5 seconds and lean back. I can repeat that 5 or 6 times. Again, in future blog posts, we're going to show you how to use a band to make this a bit better. The other position I want to check is internal rotation. I should be able to lay back, rotate that hip out to the side about 40 degrees, and I'm stuck. So what I want to do is I want to bias that position in an all-fours position, back straight. I'm going to throw that hip into a little internal rotation, and I'm going to lean back into it, work that internal rotation position. Okay, and just kind of dig that area out. Spend a few minutes working there. Again, in future blog posts, I'll show you how we can use a band to make it, again, a bit better. So there you go, shin splints in 6 minutes. Did we make it? Let's check the clock. 6 minutes and 25 seconds. We're going to call it 6 minutes and 25 seconds shin splints, I guess. But there you go. Clear the ankle, clear the hip, see what happens. My guess is that's going to help with a lot of your symptoms. If they get bad, go see a professional, let them help you out, let them deal with some of that stuff, and let them deal with the painful part of the issue. They can do some things, some manual therapy techniques or trigger point dry needling, things to help get that thing calmed right away. So there you go. If you have any questions, put them on our Facebook page, put them on our blog. I'd love to continue to answer them, whether it's this or something else, another topic you want to cover. I want to know about it. I want to hear it. I want to help you guys out. So thanks for watching. Stay tuned, and we'll keep going here in the future. Again, looking to get ready for CrossFit and help you guys get better at the same time. Thanks again.